Good evening, ladies. I am Dr. Rahul Nagpal. I am a consultant pediatrician working in New Delhi. I have my own clinic and I also work from Fortis Hospital, Vasant Kunj. I am heading the Department of Pediatrics and Neonatology there. Today, my topic is baby's weight, and I will be taking few questions on baby's weight. This is the most important factor when the baby is born. Whenever a baby is born, the first question asked is, are the mother baby asked are okay? The second question asked is, what is the baby's weight? And it gives a complete sense of satisfaction to the whole family if your baby's weight is good. Over a period of time, like many parents, you must be wondering if your baby is growing well or not. And always there is an anxiety and there is some fixation. What is the baby's weight? Healthy babies can be of different sizes. Like everything has an average. For example, say let's talk about hemoglobin. Hemoglobin average is 10 grams per deciliter to 14 grams per deciliter. Similarly, baby's weight also has a range. So one baby could be 3 kilograms, the other baby could be 2.5 kilograms. Both are normal. So we have to consider when we estimate the baby's weight, whether the baby's what was the birth weight. At checkups, it is not only the weight which the doctor will look into, he or she will look into the height of the baby, the head circumference of the baby, and the development of the baby, and then tell you how is the growth and development of your baby. From birth to age 6 months, your baby grows about 1.5 to 2.5 centimeters a month. Regarding weight, your baby gains about 140 to 200 grams per week after birth up to 3 months. After 3 months, this weight gain becomes 100 to 150 grams per week. And this is valid up to 6 months. From 6 months to 12 months, your baby will gain or is expected to gain about 70 to 90 grams per week. So as you understand, the weight gain falls after 6 months really. If we take this formula in entirety, your baby is expected to double the birth weight by the age of 5 months. So a 3 kilogram baby will become 6 kilogram, and a 2.5 kilogram baby born at birth would become 5 kilograms at 5 months. At 1 year of age, your baby normally triples his or her birth weight. So a 3.5 kilogram baby will probably weigh about 10 kilograms, and a baby who was born at 2.5 kilograms is expected to weigh 7.5 kilograms at the age of 1 year. These are obviously rough formulas. You cannot just say by these formulas that this is the expected weight. Talking about the weight, as I mentioned, it's not only the weight, it is how your baby grows, and that is the weight or the growth chart we are talking about. Growth charts are visible display of your child's physical growth and development. They are also called road to health chart, in which we measure the baby's weight, height, head circumference at birth, and then at different periods of time to know what is the growth chart and whether the baby is following the particular growth chart or not. Many times, and I have been asked this question, my baby is not as big as my other baby, or we in the family have 3 babies of similar age or 2 babies of similar age. His weight is 7 kilograms at 5 months and my baby's weight is only 4.5 or 5 kilograms at 5 months. So my answer is that every baby has a different growth pattern, and as I mentioned earlier, it lot depends on the birth weight. And even if the birth weight was similar, different weights at different ages are expected. Some babies may be more active, some and may lose their calories. Some babies may are just happy feeding and not moving at all, and their weight gain is much more. Bottle fed babies may initially gain weight much faster than the breastfed babies. So there are many variables in the weight gain. We have to see as doctors whether your baby follows a correct growth pattern which is measured by the growth charts or not, and that is more important rather than a single weight which is measured at a particular age. I will give you an example. For example, we always talk about your baby's weight or height or many other factors in terms of percentile. So, if between 3rd to 7th, 97th percentile is taken as normal. At birth, the 3rd percentile according to WHO standards is 2.4 or 2.5 kilograms, and 97th centile is 4.2 kilograms. So in fact, that is the wide range of a baby who is 2.5 kilograms or is 4 kilograms. Both are normal at birth. But as I explained to you earlier, the growth pattern may be different. So if your baby is having less weight as compared to your baby in family, he or she is necessarily not having any issues. So this is about the weight, and I wanted to only mention that each baby has a strength of his or her own, and weight, though an important criteria, is not the only criteria to know the well-being of a child. Now coming to some specific questions which you will ask, and I will try to answer them and give you more insights into it. So the first question, a mother of 6 months old child is asking that my baby is 6 months 7 days and her weight is 5 kilograms. She drinks very less milk. She is not able to sit with support. So as I mentioned earlier in my talk, that a 6-month-old baby whose weight is 5.9 kgs is at almost 3rd percentile, which could be normal, provided we know what was the weight at birth. Say the weight at birth was 2.5 kilograms, then this weight is at this age is normal. But if this weight was 3.5 kilograms at birth, certainly at 5.9 kilograms the growth has not been appropriate, and we want to look into other factors. Besides that, we also have to measure what is the activity of the baby. Is she otherwise a happy baby? Does her milestones normal in terms, can she hold her head, can she turn around? Sitting with support can arrive between 5.5 to 8 months, so there is really no hurry, but we have to see the baby in totality. In case the baby has not achieved some milestones like an eye contact, like moving, like holding the head properly, or not being able to turn completely, in those situations this question or this problem of not sitting with support could be a problem, but I don't foresee any problem if all other parameters are normal. I am sure your pediatrician will be able to tell you better after examining the baby. The second question is a mother of a 2-month-old child who says that my baby is weight 4 kilograms at 2 months. Is it a normal weight? As I mentioned earlier, this weight could be normal if your baby's birth weight was around 2.5 kilograms. And even if your baby's weight was 3 kilograms, and the weight gain has been only 1 kilogram, which is less than expected. But if your baby is otherwise active, her developmental milestones are normal, her reflexes are good, then probably you require only some other further counseling after considering all the parameters. You also have to know what is the baby's height, whether the height has been in within that growth pattern or not. As I said again, the birth weight is important. To plot the baby's weight in and the growth chart will tell us and give us a better information rather than only a birth weight. I'll take another question. So the third question is, my baby is 4 months old and her weight is 5 kilograms. What should be the weight at this age? She is only on breast milk. Shall I start with some extra foods? So there are 3 questions. So what should be the weight at birth at this age? At a 5-month-old weight, the percentile is 5.6 to 8 kilograms of weight. Now, as I said, I have to know what is the weight at birth. If your baby was low birth weight, probably this weight is normal. If your baby's weight was 3 kilograms, probably this weight growth has not been well, is not good. So it is the growth chart which will tell us. Breastfeeding is very important. I am glad that you are continuing the breastfeeding. Breastfeeding up to 6 months is strongly recommended. It is not only good for the growth of your baby, but it is also good for development of your babies, and it acts it gives you so much immunity to your babies. Breastfeeding is the best. Extra food, I don't think so, unless your baby does not fall into a growth chart, which is growth chart is not normal. If the growth chart is not normal, maybe some supplementation may be required. I would also want to know what is the height of your baby, height at birth, height now, weight at birth, weight now, head circumference at birth and head circumference now, and what are the developmental milestones. If all these parameters are known and they fall into the normal growth curve, please do not worry. The third question, it's very interesting, and thank you for this question. Would like to answer this question. The question is, my baby has cow's milk protein allergy. Which milk should I give to your baby? To my baby. So the first thing is cow's milk protein allergy. I'm sure your doctor must have diagnosed it well to know that it is cow's milk protein allergy. It is known as CMPA. If it is actually cow's milk protein allergy and it has been diagnosed by your doctor, the first thing is that you should only give your breast milk provided you do not take any dairy products. You should keep away from all the dairy products, normal milk, curd, paneer, and even tea in your coffee, tea, milk should also be avoided. So start having black teas or black coffees. So no milk in your diet. If your baby is actually cow's milk protein allergy, you will see the difference within 2 to 3 weeks of stopping your own milk consumption. If for some reason your breastfeeding is not being given, or breastfeeding is not adequate, or there are other factors and you have to give another milk formula, and actually if your baby is CMPA or cow's milk protein allergy, then one could try soybean milk formulas. Here I must give you caution that cow's milk protein allergy, those babies who have cow's milk protein allergy, 60% or 40 can have soybean milk protein allergy also. So it is not definite whether soybean milk will help your baby or not. The next option is to have hydrolyzed milk formulas. There are many in the market now in India. So these are partially hydrolyzed milk formulas or completely hydrolyzed milk formulas. I won't be able to tell their trade names, which is unethical, but the market is full of partially hydrolyzed and completely hydrolyzed milk formulas. And if your baby is definitely cow's milk protein allergy, then I would prefer you to have complete hydrolyzed milk formulas. It is a little more costly, but it is beneficial. So that's what it is. Now the other question which normally is asked is to me is that my milk is not enough at 3 months. Can I give cow's milk? So my answer to you is, in a short way, no. If you are a healthy mother, your breast milk is sufficient for your baby. If the growth pattern of your baby is normal, please continue your breastfeeding till 6 months. Due to some medical reasons, if you cannot give breast milk, then you should give a milk which is closer to breast milk. Cow's milk is not recommended by Indian Academy of Pediatrics or the UK Academy of Pediatrics till 9 to 12 months of age. So that is one message I wanted to give you. If you have to give, you have to give a formula feeding, and formula feeding is also basically cow's milk based, but it is formulated in such a way that it comes closer to the breast milk. As I said, first 6 months breastfeeding is the best, and even after 6 months, once you have started complementary feeding, you should continue your breastfeeding as long as you like. There is another question which has been asked to me, that my baby is 20 months old. The baby's weight is 10 kg. उसका weight कैसे बढ़ाएं? So 10 kg baby, I don't want to repeat myself. I have to know what is the birth weight, what is the weight at 6 months, and plot the growth chart. But yes, here a 20-month-old baby, how much milk does he require? This baby requires only 300 to 500 ml of milk in 24 hours. Yes, you could breastfeed. Also, you could give other milk formulas, and here it could be any milk which comes at home, which is clean and pasteurized. Complementary food is started at 6 months of age, and for a 20-month-old baby, my best advice to you is give home food. Give food which you eat. My message is, eat with your child. Children like to eat what their parents eat. Parents are the role models. Many times I have seen a lot of babies being fed a particular food which is baby food, which is considered healthy, and baby is running around and the mother or the father is running after the baby. Please remember, more you run after the baby will make you run after it. Eat with your child. Home food is the best. There is no need for supplementation with artificial foods unless it is medically indicated, which your doctor can always tell you. Thank you. We'll meet you at Mylo again. Goodbye. Thank you.